Our next speaker is Niraj Jetli. He is the Chief Operating Officer and CIO for Nutrisavings. He is a nationally recognized business leader and digital strategist with strong background in technology and a track record of innovation. I'm sure some of you in the room might have been on the webinar that we had a few weeks ago with Nutrisavings. He's going to share a little bit about that employer case study with us today. Let's welcome him.
Thank you. Yeehaw! All right. This is my first time coming at the Midwest Business Group on Health seminar, and thank you, Larry and Cheryl, for the invite. Somebody asked me this morning, how is this session going? And I looked at them and said, this session is a very unique blend of intricacies of healthcare reform, garnished with the trends in wellness industry and new concepts, stuffed with the challenges that a benefit administrator is facing on a day-to-day basis. It is a very delicious recipe. I'm loving it. As some of you might have guessed, I am here primarily to talk about food and nutrition. Very simple. Food and nutrition at work site, and the importance of food in addressing many chronic conditions which are preventable because we are not eating good food. And for making my case, I would like to share with you two personal stories, and I would like to tie those personal stories into a client case study that we worked with since last summer. The client is Maine Health. Maine Health is a large hospital system with around 17,000 employees based in the state of Maine, having around 15, 16 locations, and they have been working with us since last summer. So my first story is titled Confusion. Almost all my adult life, I have struggled. I've struggled with a battle between my brain and my taste buds. And this battle gets intensified every time I go to grocery store. And many times, on many occasions, my taste buds have won. And every time they won, I won as well. You might be thinking, how can I win? Because I gained something. I gained extra weight. I was never on the losing side. So a couple of years ago, I decided to take control of my weight problems. And I pledged to myself to create a 6-month plan without any social support, so it failed very miserably. I created a 6-month plan, and the plan outlined few things. One, I would not give in to my taste buds for 6 months. Number two, that I will work out 5 times a week for an hour. And I will do weekly weight check-ins with my weighing scale to see how I am making progress. So I started my plan, and within a couple of weeks, I was stepping up on my weighing scale, and the needle did not move, not even 1%. I thought, you know what, I am right. Maybe this weighing scale is wrong. I go out, buy a new weighing scale, same result. That got me scratching my head. How is this possible? I'm not a dietitian. I'm an engineer by education. So it's pure mathematical thing. If I spend more calories than what I consume, technically I should lose weight. That's how many of us think like that. And I'm vegetarian, so my diet should not be an issue at all. But results were results. So finally, to get to the root cause of the problem, I started food logging for a few days. And I found the culprit, besides me, of course. The culprit was my evening snacks. And my salty snacks that I consume every day, still I do, were loaded with sugar. I didn't know that. Not in my wildest imaginations I would have even guessed that. I took that snack back to one of my friends who is a dietitian and said, whether you eat this snack or a tablespoon of sugar, they may taste different. Below the neck, metabolically, they are the exact same thing. I had no clue what they are talking of. So how do I lose weight? So you had two options. One is give up on the snack, which I could not imagine, living my life without snack, or give up on the dream, which I could not imagine either. Like, give me a healthier snack. And that's, again, next confusion started. It is much harder to find a healthier snack. So that confusion left a profound impact on me. So a couple of years ago, when we started working on Nutrisavings, we wanted to address this confusion. So we hired a panel of dietitians and nutritionists to look at all the food items you can find in the supermarket, take all that information that you are seeing on the packaged items of all the food items, create a simple to understand nutritional score between 0 and 100. Healthier the item, higher the score, and the vice versa. For example, we all know broccoli is healthy for us. It scores 100. We all know something that's not good for us, they score 0 or 1. Now, to make it much easier for mass adoption, we created a mobile app also that consumers can take with them, go to the grocery store, pick an item from the aisle that I'm going to pick right now, scan the barcode of the item, and say, oh, this scores 68. And by the way, if I really want to have a healthier option of this thing, the other healthier option right on my smartphone. So that simplified a lot of things, because we found out that a lot of people are confused about what is healthy when they go to grocery store. Just like the example Sean mentioned this morning, people don't know if this plan is the right plan for me for my cell phone. People don't know what you're buying. Even half of the stuff is chemical. We don't know exactly what that really means. So that's my first story. So as my second story is talking about affordability. So last summer, we were at Maine Health on doing enrollment events. So we had a big booth set up. Employees were coming in, signing up. And one gentleman came in, looked at all the papers, then was walking away. I said, sir, you can sign up. No, this stuff is not for me. You're an employee, right? Yeah, I'm an employee. But this healthy stuff, it's not for me. I said, why? It's for all of us. We all eat. And looked at me. Say, do you have a clue what's going on in my life? What do you mean by that? I'm living paycheck to paycheck. I'm worried whether I can pay my next month's rent or not. I cannot sleep at night because I don't know if I can make my next week's car payment. And you're telling me to buy healthy food items? Are you kidding? He was loud, he was rude, but he was right. He was right, because many of our co-workers struggle with affordability of healthy food items. I looked in his eyes and said, you are right, but I can beat it. I said, what can you beat? I said, what do you eat usually? I said, I walk over to a fast food joint, which is 1 block from where I live, grab a hamburger, soda, and fries for under $6. Can you beat that? I said, yes, I can beat that. In fact, I have already beaten that. So what do you mean? So as a part of this benefit being rolled out to all the Maine Health employees, 17,000 employees, we have connected all of you to all the local grocery stores in the state of Maine. That means Hannaford stores are linked, Kmart is linked, Shaw's is linked, Food City is linked, and guess what? Many of these grocery stores are actually giving you discounts for buying these healthy items. Plus, your employer is having an incentive plan to actually give you cash for buying healthy food items. And if you add these things up, just this month, you can save $160 on doing something that you already do, which is eat food. And his jaw dropped. I said, oh, I didn't know, is this possible? Said, yes. And that was the confusion that employees had, and he signed up after that. So putting these two stories in the context, we all know that for making healthy food affordable, we need to reduce confusion at the grocery stores, which is already done. We also know we need to make healthy food a lot more affordable which is done because we have got employer incentive plans. We have got incentive plans from health plans and grocery stores and food manufacturers funding in these discounts so employees can buy healthy food items. Last but not the least point is, how do we connect these employers to the local grocery stores? So what we have done is we use the employers, the grocery store's grocery rewards card. Like this is Mariano's rewards card I have got in my hand. We link it to your shopping trip. So imagine I'm going to Mariano's, I buy whatever I want to buy, at checkout, swipe my card the way I usually do. A few days after my shopping, I get an email telling me this scored 68, this scored 45, my average score for the shopping trip was 50, and by the way, these are the options you can buy next time to do healthier savings. And this is the amount of money you saved funded by either the health plan or the employer or the food manufacturer. So that's what we are doing, very simple things, but it touches everybody's life. Thank you.